Hello, my name is Ashwin Sridhar. I'm a consultant urologist, and as a urologist, I specialize in conditions of the kidney, bladder, and prostate. I'm recording a series of videos to provide some information regarding common conditions that you might come across when you are looking for a urology specialist. Please feel free to go to the videos and come and see me if you would like to discuss any of these further.
I'm getting up at night to use pass water. Is that a sign of prostate trouble?
So changes in your bladder habit can be a very common thing as you grow older, and there are a lot of things that contribute to it. The most common contributing factor is an enlarged prostate and some issues within the bladder that makes you go more often and more often at night. Other things that can contribute to this include pre-existing or conditions you already have, such as hypertension, for which you might be on medication, or conditions of the heart for which you might be on medication, or even diabetes. And all of these can contribute to this particular symptom.
Why does my pee sometimes have a strong smell?
When the urine smells, usually it suggests that it is staying in the bladder a lot more than it should be, and this can also lead to an infection of the urine, and that can contribute to a smelly urine. Sometimes it can be related to diet, so something you eat can add to the smell of the urine. Or if you're not drinking enough fluid, then your body is not producing enough good quality urine, and that can also alter the smell. Certainly, it's worth seeing an expert like myself to assess your waterworks and see if there's anything we can help with.
What causes pain in the bladder?
Pain in the bladder can be a very distressing symptom. Sometimes it can be due to an infection. Sometimes we find no infection, but there is a lot of inflammation or reaction within the bladder that is causing pain. Occasionally, we don't find anything within the bladder. If you would like to have a further discussion about how to evaluate this, please come and see me. We will start off by talking about when this started and what makes the pain come on. We will talk about what medication you're on, what you have tried. We will examine by having a feel of the tummy, doing a urine test, doing a scan of the kidneys and the bladder to see if there's anything that can be found. I might even suggest a camera test, which is called a cystoscopy, to look at the inside of the bladder and the water pipe. Along the way, if we find infection, we can treat it. If we don't find infection, we can talk about the ways of treating pain in the bladder, which usually involves multiple specialists, not just a urologist. It could involve a urologist, a pain physician specialist, and a physiotherapist. It is usually an involved process of treatment that can take many weeks to months. And hopefully we can get you over this symptom.